side, you say?
Seen is safe.
The mechanism of injury is falling from this window.
Okay.
Alright. One patient?
Tell me about the mechanism. What's going through your mind?
Could be. He fell, so.
Is it just any old fall?
No, it's pretty hard fall.
How do you know it's a hard fall?
Well, he fell from a third-story building.
There you go. He fell 3 stories.
Yeah.
Third-story balcony.
Mm-hmm.
So it's a significant mechanism of injury. What should be going through your mind?
C-spine.
Well, if an
spinal
adult
injury.
male fell from a third-story balcony, what injuries would you be suspecting?
Depending on how you fell, leg injuries, spinal injury,
Okay.
neck injury.
All right, good. So this should be going through your mind, okay? All right, proceed. Good.
I'm gonna call ALS.
Good.
I'm gonna get C-spine on right away.
Okay.
Have someone hold C-spine.
Don't jump. Don't jump. C-spine will come.
Okay.
Finish your scene safeties. Finish that.
Okay.
What is that first block?
Well,
Scene size up.
Scene size up. Finish your scene size up.
Okay.
Don't move on until you finish. Okay.
All right.
You hit everything in that scene size up.
Okay, so ALS.
Okay.
I don't know if it would be in the scene size up.
There's a lot of things in the scene size up. So you asked if it was safe.
Mm-hmm.
You asked for ALS.
Mm-hmm.
Okay.
I'm gonna consider C-spine then, because that's the first.
You're going to take C-spine.
Yeah, I'll take C-spine.
You won't forget that. What else is in yours?
Now I forgot now all. Additional help, known patients, mechanism of injury.
You got mechanism.
My general impression of the
Okay,
patient.
all right. You see a 35-year-old male.
My general impression would be pretty bad.
Yeah, he's laying on the ground. You notice some dark red blood on the back of his, coming around the back of his head. Okay, that's what you see.
His responsiveness?
Patient is unresponsive.
Unresponsive. Well, if he's unresponsive, then chief complaint would be, I wouldn't be able to get one. And
What comes after your scene size?
ABCs.
ABCs.
Okay. What else? You asked for a general impression. What else is?
The general,
And you asked for level of consciousness.
and then chief complaint, apparent life threats.
Apparent life threats. Do I have any apparent life threats? What would apparent life threats be?
If there's anything that, I'd have to do an exam on him to see if there's any, or apparent life threats like
Airway.
airway.
That could be an apparent life threat, right?
So
Bleeding.
What else? Think. What could be an apparent life threat?
Bleeding.
Bleeding. What are you gonna do?
well, I'll check his airway.
No, you're not.
Oh,
If you have an apparent life threat, you've got
jump on it.
pulsating arterial blood. What are you gonna do?
Check where it's coming from and
No, you're not. What are you gonna do?
fix it.
You're gonna fix it. And how are you gonna fix it?
Well, first you gotta see where it's coming from.
Right?
So
Wherever it's coming from,
Okay.
it doesn't matter. What are you gonna do?
Stop it.
stop it.
Thank you. And how are you gonna stop it?
Pressure and
Are you gonna do that?
or have someone
I'm gonna have somebody put direct pressure on it.
that. With,
Stop that bleeding, okay? Fix it. Deal with your apparent life threat. Any bleeding. He may be impaled. It may have to be stabilized, or he may be, impaled and combative.
Mhm.
You're gonna have to control that situation. So you've got to correct any apparent life threats. Okay, move on. This happens so quickly. It's not slowing you down from doing your initial assessment. Okay, think about that. All right.
So you said he's bleeding out of.
I didn't say he was bleeding.
You said there's a
You
pool
have
of
to
blood.
ask for
Okay.
apparent
Okay.
life threats.
Okay.
Okay. that
Well, then
is
you
something
don't.
that has to be corrected.
Well, we don't explain it to parent life threats. Then we just ask if there's apparent life threats.
Right, and then I would tell you, well, you see bright red bloods coming from the left leg.
Okay. So
I'm not saying this is this scenario. If you said, are there any apparent life threats?
Mhm.
And I would tell you if there were, okay? Like, and that would mainly be arterial blood, where the patient could bleed out in seconds.
Are there apparent life threats?
No apparent life threats.
Okay.
Got it. Wow. I'm gonna beat it into you.
Then I'm going to assess his airway and breathing.
Okay?
How's his, does he have open airway?
He has, I have to find everything. He has frothy blood coming from the airway,
So like around the mouth?
coming from around the mouth, frothy blood.
All right. So so we would
Does he have an airway?
No.
What are you gonna do about it?
I'm gonna
Suction.
suction.
Or are you gonna direct someone to
I'll
suction?
direct someone to suction.
Right. That means if he's got frothy blood, he has an airway obstruction. He needs to be suctioned to correct it. Don't move on until you correct it, okay? Correct it. I'm gonna direct somebody to suction that airway. Well, first, don't forget, you're gonna have somebody take that C-spine, because remember,
Yeah.
that was way down the list. But don't do that so soon. Think about your scene size up. Go to C-spine and your initial assessment, which is your general impression and your level of consciousness, immediate life threats.
Okay.
Correct everything as you go along, okay? If crowd control needs to be dealt with, deal with it, okay? Don't move on. Even your test questions are set up like that. I mean, you could have a patient on a test question who's bleeding, but you got a crowd out of control. Deal with your crowd, because in order.
Yeah, the reason why that's how we were taught is do C-spine right away. That's one of the first 6 things that you say on all of these is consider C-spine.
Of course, that's part of your scene size up, right? Isn't that in your scene size up? Okay, so BSI, is my scene safe to enter? Do I need additional backup? How many patients do I have? Do I need additional backup? I'll call for ALS, I'll call for flight. What's my mechanism of injury? Fall from a 3rd-story building. I'm going to direct somebody to take manual C-spine of the patient. You see, in order. In order.
Okay.
That's pretty quick.
Okay. And all right, so I'm gonna have someone suction him.
Okay?
What's his breath sound like?
Okay. What do you want to know about there are 3 things you want to know about breathing. You've heard me say it. What are they? And remember it in this order. Go ahead.
Well, if he's breathing, if he's getting,
You want to know
adequate-
rate, depth, and quality.
Yeah.
Is my patient breathing? How fast or slow? Do I see equal chest expansion? What's the quality of my breathing? Okay? Try to remember it like that. That's the only way it's going to help you. You won't be jumping around all over the place. So what's my rate? Start with rate.
What's the rate of the breathing?
He's breathing about 8 a minute and he's irregular.
Irregular. Chest
8
doesn't
a
pump?
minute and irregular. Don't move
Okay.
on until you fix it.
Well, I'll go ahead and have someone. I'll have someone start a BVM on him.
Good. Why is it important to have somebody bag him?
Because his breath rate is really low.
And what's the
Irregular.
problem? What's the problem you're trying to fix?